All right, good morning. Today we're here to do a kickoff for our ShotSpotter technology. This is gunshot detection that's really designed to make our community safer. With me today are some partners, and I do want to mention them first of all because this was not possible, just like anything in life, without partnerships. Up here with me I have Chief Randy Walston, and beside him is Dr. Eric Toschlog. Dr. Toschlog is the head trauma surgeon for Vidant Hospital and has been a big partner with us since the beginning. So my first conversations was with Dr. Toschlog, and he was interested in helping bring this technology and get it funded for us. Technology can really support the officer's mission to serve their community. We looked for and found ShotSpotter technology. It allows us to respond, it sends an alert automatically to the police department for any outdoor gunfire in the protected area in 30 to 45 seconds. Now that's a huge advantage for us.
Fortunately, I was approached by the chief of police here in the Greenville Police Department. I was honored to meet with Chief Holtzman, and he first introduced this technology to me, the concept of this technology. And then I met with representatives from ShotSpotter, and I saw the technology demonstrated to me, and it was intuitive that this would have a significant impact within our community. The Vidant Medical Center Foundation found this concept very important because the medical center has two purposes. First and foremost is to care for the citizens of Eastern North Carolina and for Greenville citizens in terms of providing them excellent health care. But Vidant Medical Center is also very invested in the community in many other ways besides health care. We see a total of approximately 4,000 injured patients a year, and because our penetrating rate is approximately 10 to 15%, we're seeing between 300 and 500 gunshot victims a year at the trauma center. As a trauma medical director, I'm heavily invested in injury prevention. So I would expect, based on what has occurred in other cities that have utilized ShotSpotter, is to see a reduction in the number of gunshots and correspondingly a reduction in the number of gunshot victims in the community in which we've deployed ShotSpotter. The second general area that I think is incredibly important is the speed at which the patients can now get to the medical center, to the trauma center, compared to before we had ShotSpotter in the community. It's been well demonstrated through a number of studies that penetrating injuries require more blood transfusions, they require more fresh frozen plasma and other agents to get patients' blood to clot, and they require operation and the operating room resources much more frequently than a blunt trauma patient. So a gunshot victim is resource intense, and many of the gunshot victims are so severely injured the gunshot corresponds to a multiple week intensive care unit stay. So the potential reduction in the number of gunshot wounds we see at the trauma center at Vidant is important, but a corollary of that is also there should be significant cost savings with that reduction in gunshot violence. So my interest in ShotSpotter is obviously reducing the amount of time that it takes to get an injured victim to the medical center, but even prior to the gunshot victim being shot or the injury being incurred, I'm very interested in the injury prevention aspect of ShotSpotter, in that we have seen a number of communities around the United States have reductions in their gunshot victims by 30%. And if we could have a 30% reduction in the number of gunshots in West Greenville, that would be tremendous for the community and for the medical center.